So postpartum depression is a huge issue for mothers and for the family and for their babies. We screen routinely for postpartum depression at their first postpartum visit. We also try to ask the patient during the pregnancy about how they're feeling, and we look to see if they're at risk for any postpartum depressive symptoms. One of the things that we see is that postpartum depression can start actually during the pregnancy, and it can last usually up to a year. We see that it is often associated with some anxiety. Most people who have seen a therapist or been diagnosed with depression or anxiety prior to the pregnancy actually are more aware of their symptoms and reach out for assistance beforehand. It's the patients who have never experienced any postpartum depression that I am personally most concerned about, because they don't really know what to look out for. Something to look out for is sleeplessness, but it's hard to say to a new mom, hey, are you getting any sleep, when we know they're not sleeping. But really the inability to calm down and to sleep when their baby is sleeping, not eating properly, not asking for help, thinking that they're the super mom and they have to do it all, and really the postpartum time is a beautiful time, but it's also a time filled with a lot of new things and new anxieties, and still having to make sure that they're still doing everything else that they're supposed to be doing in our crazy busy world. So it's important to not only screen as the obstetrician, but also, I think we've seen this through the development of how common postpartum depressive symptoms are, is that the pediatricians are also screening these days. One of the things to do when we identify a patient who may be suffering from postpartum depression is to really, in our office we have a system to reach out to the patient after their visit to make sure that they followed up with the recommendations from their physician. But also, we, before they leave our office, we set them up with some referrals. We set them up to see either a therapist that they've been seeing for a while, or to a new therapist. Sometimes we have them see a psychiatrist also if they're identified as requiring medication as well. There are some motherhood centers that have been established to really deal specifically to postpartum depression and not just depression in general, that will incorporate some group therapy, and we like to work in conjunction with them to support the mother during this time. A lot of women have also been reaching out to getting postpartum doulas in order to facilitate this new process. But remember, most postpartum women see the gynecologist obstetrician only about 6 weeks postpartum, and my concern is a lot of people have a lot of support in the first couple of months of having a newborn, but it's that time when everybody kind of goes back to their routine life and there's not so much attention placed to the mother, when postpartum depression still can be a significant issue. So it's really important for all of us that are taking care of the patient to realize that postpartum depression can happen at any time, and that the patient should realize that she's not alone, and there are a lot of support services out there, and that if she requires medication, there's no such thing as failure with this. This is something that a lot of times is hormonally caused, and that we can really treat it if we have all the support